Hey everyone, Julie Traeger, health and wellness coach. Welcome back to Small Bites. And I hope today, Friday the 13th, is going really well for you. I hope you're not experiencing any of the bad juju that we normally associate with Friday the 13th and that it's going really smoothly and well and you're doing okay today. So, I'm talking about sleep issues today, and I'm kind of piggybacking off of my talk from last week on adrenal fatigue because adrenal fatigue and sleep are actually pretty intimately connected. For one, chronic stress can actually cause surges in adrenal hormones, and that increases alertness, and then that creates this chronic hypervigilance state that makes sleep difficult. So, and by that I mean both going to sleep and staying asleep. And then, in addition, not sleeping also stresses the adrenals. So, you and if you're suffering from adrenal fatigue, that means that it kind of creates this vicious cycle where you've got poor sleep is actually a cause and an effect. So, if you are suffering from adrenal fatigue, if you scored kind of high on our quiz from last week, or the yeah last week, then you really should focus on sleep because it really is one of the most important things that you can do to recover. Sleep is really a growing epidemic in the United States. 50 to 70 million Americans don't get enough sleep. And poor sleep leads to auto accidents, a host of chronic diseases like hypertension and obesity, diabetes, depression, and even cancer. It leads to digestive problems of both the lower and the upper GI tract, and it affects your just overall quality of life. We know that. It also saps your energy, as you well know, and study after study indicates that it can negatively affect your work performance. So there's growing evidence that missing sleep increases appetite as well and leads to obesity. And kind of going back to that discussion I just had about adrenal fatigue and sleep being intimately connected, and knowing that adrenal fatigue causes you to hold on to belly fat. If you're trying to lose weight, again, focusing on sleep is one of the best things you can do. So, what are some of the known causes of insomnia? Alcohol intake is one. And I know people tell me all the time, well, drinking a glass of wine before I go to bed actually helps me fall asleep. And that may be true, but study after study also suggests that alcohol intake actually causes you to have sleep that's less deep. Your REM sleep isn't as deep, and so that means you're waking up multiple times throughout the night. So it may be easier to go to sleep, but it's probably harder to stay asleep with alcohol. Caffeine intake, tobacco intake, going to bed hungry is one actually. Low blood sugar can cause you to wake up multiple times during the evening. Your nutrition. Studies are also indicating that the more junk food you eat, the more your sleep can be disrupted. There are some medicines that can cause insomnia, NSAIDs, cough and cold medicines, antihistamines, Wellbutrin, a lot of cardiac meds, including beta blockers, actually, inhalers for asthma, steroids, even topical steroids can cause sleep issues, diuretics, and then and SSRIs are another big one as well. And then there are some supplements that can cause sleep issues, including CoQ10, chromium, and St. John's wort. So, what are some ways to improve sleep? Turning off all stimulating electronics, and okay, that didn't sound right. Let's back up. Turning off your cell phones, your iPads, your computers, those kinds of stimulating devices. So that, I mean, Kindles are okay. So reading before bed is okay, but not watching TV, not doing any internet searches, not working from bed. It's a good idea to just stop all of those activities before at right around 9 o'clock, about an hour before you go to bed. Placing a cup of water on your nightstand with some lavender, some pure lavender oil is good. Lavender is great for sleep. There's also some lavender sprays that you can get to spray on your sheets, and those are kind of nice. But anything lavender is good. Drinking a cup of chamomile tea at bedtime is great, although not too big of a cup of tea because then you're going to have to pee, and that just defeats the whole purpose. Don't exercise within about 3 hours of trying to go to sleep. Don't drink caffeine after midday. And honestly, some people are just going to have to give up caffeine altogether. So if you try a lot of these other suggestions for sleep and you try giving up caffeine after like about 2 o'clock and 3 o'clock in the afternoon and that doesn't work and you're still not sleeping, you may actually need to try giving up the caffeine altogether and see how you do. 'Cause some people just can't really tolerate it. And then not watching the news at bedtime, just the negativity and the discussion about violent acts and politics, it just gets your brain going and gives you a surge of adrenaline. That's not great for bed. There are actually some foods that you may want to avoid in the evening if you can, that can cause sleep disruptions, like ham, all forms of sugar, really, hard cheeses, and tomatoes, believe it or not. And if you're hungry at bedtime, there are some snacks that actually promote sleep. So chickpeas, bananas, rice, milk. Those are some things. Oh, and oats as well. Those are some things that actually can promote sleep. And then there are some supplements that you can be really helpful too. And some of these, two of these actually, are supplements that I really kind of consider supplements that pretty much every adult should be taking. And that's vitamin D3, which we talked about a couple of weeks ago, about 10,000 milligrams of D3 a day. And then magnesium. 2/3 of Americans are deficient in magnesium as well. And taking about 500 milligrams of mag a day is a good idea for pretty much everybody. And in addition, most of you have heard that melatonin is good for sleep, and that's really true, but you may not know that the lower the dose of the melatonin, the better for sleep. So some people actually take melatonin as an anti-inflammatory, and they take it at higher doses for that, and that's fine. But studies have really shown that 6 milligrams or under of melatonin those are really the best doses for sleep. And if you've never taken melatonin before, I advise starting really slowly and kind of building up over a 2 to 3 or 4 week period. So start with a half a milligram to a milligram and then just build up slowly over a few weeks. Because melatonin can actually cause some pretty interesting side effects, such as morning lethargy, headaches, dizziness, vivid dreams, depression, fatigue, irritability. So, if you're experiencing any of those things after you started the melatonin, you may need to go down in your dose or just stop altogether. And by the way, for my nurse friends, and I have a lot of you out there, so shout out to all my nurse friends. Nurses statistically have a high level of obesity, osteopenia, osteoporosis, depression, and breast cancer, in addition to sleep issues. And there are studies that indicate a high correlation. Oh, sorry, you're going to hear a dinging. That was my email going off. Studies indicate a high correlation of these diseases and low melatonin levels. And in addition, low levels of melatonin are also correlate to migraines and Crohn's disease. So if you have adrenal fatigue, if you have belly fat, obesity, and you have any of these other medical issues going on, starting a dose of melatonin, even a low dose, can really be helpful. So that's all I have for today. Have a great weekend, everyone. Thanks for listening, and I'll see you next week. Bye.